and also an opportunity to give back what I have had from Arvind, as we always fondly called him. Now, Alok had wonderfully said all the great qualities about Arvind, but that's taking like coal to Newcastle because all of us know Arvind very well. His great academics, wonderful surgeries, a great teacher. But what we always remember him is for this wonderful smile. I mean, I don't think any of us can remember Arvind without this smile. And his genuine human nature of reaching out to people, giving them the best advice, and being really concerned for them is what made Arvind very different. I can tell you countless personal events where he showed what a great human person he was. So when we decided to expand the Ganga Hospital, it was a big jump from 130 beds to 500 beds. And one day people were giving all kinds of advices, and there was a call from Arvind in middle of the night, around 11 o'clock. And he said, Raja, I just heard that you are going to expand to 500 beds. I said, yes. He said, I just want to tell you one thing, please take care of yourself. This is going to be one of the most stressful period. I'm just praying that you should be successful in this project. He didn't talk of all the other things, but he was concerned only about my health and how we are going to bear it. And that made Arvind a different person from everybody else. The last time I met him was in Mumbai, and there was a lot of crowd around me, around him, around both of us, and so we couldn't snatch a few moments together at all. But just in the left, when we both were together, so I said, Arvind, take care. So he said, Raja, maybe too late. But he held me tight and told, now will you promise me that you will take care of yourself? That was a very touching moment. But anyway, Arvind, as you remember, when I think of him, he is a true scholar. And there is a very famous poem in Tamil called Unnai Arindal, which means if you can understand yourself. And it says that a true scholar is one that when he enters a hall of professionals, all heads will turn spontaneously to look at him in reverence. Elders will acknowledge him that there comes a man who is well read and knowledgeable. Peers must revere that he excels them in skills and ability. Youth must look up to him in awe and take him as a role model, and all accept. That means the society, the elders, peers and the youth all accept him that you are just and noble. And you see, if Arvind doesn't fit this definition, who amongst us would fit? And that's the great thing that we can talk to about Arvind. And mostly what we enjoyed having with him is great family moments, and he was intensely a family man. And our hearts go to Devyani, his wonderful son and daughter, Prapti, that they should have the courage to go ahead without him. So when I wrote his homage, what I wrote, that those who live in the hearts of others can never die, is really true because he will always be remembered by all of us. Now, the topic that was given to me is avoiding and managing failures in profession. So we discussed with Amit, and Amit chose this topic. And I was wondering, if somebody is good in tennis, they ask him to speak about tennis. If somebody is good in cricket, they ask him to speak about cricket. And I was just wondering what is the reason Amit asked me to talk about failures in life. I hope the same analogy doesn't work over here. But failure means different things to different people. So this is not for the people who are sitting in the front row. I mean, they are highly successful. but it's just for the beginners, and I would like to just tell a few important things. It's very difficult to define, but everyone knows and recognizes when it happens. And most important thing is you cannot escape failure when you want to be successful. You cannot bypass the steps of failure before you reach the top. Because when you do enough, you will definitely face failures. In fact, what is very surprising is that, or what is very comforting is also that successful people experience more failures than people who are not succeeding. And you have lots and lots of examples for that. Henry Ford went bankrupt before starting the Ford Motor. Thomas Edison, we know that all his stories. Rowling was rejected 12 times before her book was this thing. And we also know about Abraham Lincoln, what sort of failures he had before he could be successful. So you should look at failures only as a step to success. But only issue is that medical failures are multiple disasters. Because it is not one person's failure, it is the patient, and often his family suffers quite a lot. And even the doctor suffers a lot. And you all know that we all undergo a very stressful period if you have failed or you have something which you think you should have avoided. And it is not possible to overcome some sleepless nights thinking if you should have done something different. If you fail and you are not feeling bad about it, you are not a doctor. So when you are a good doctor, failures even affect you quite a lot. So avoiding failures is very important because it affects you. And it may be actually the limiting factor for your growth. This is very important. If you are scaling up, if you are growing very fast, one of the most important things is to avoid failure. Now let's look at this figure. Managing 1% failure is different when your volume is 100 or 10,000 or 30,000. So last year we did 32,400 orthopedic surgeries, and let's look how it transforms into that. So if you have an accepted norm of 2% failure, so when it is 100 it is 2, but when it crosses 30,000 it becomes more than 600. That means you are going to have 2 major failures on your hands every day. And that is not good for your heart or your reputation or for your family life or anything. So if you are going to scale up, if you are going to grow, then the first thing that you should look at not is success, but how you are going to control your failure. And this is some tips from 30 years of my experience. First and foremost, ensure your competency and the competency of the team. So while you will be training yourself, you will be thinking of many things, how to upgrade yourself, how to do things. Many times we forget how are we going to upskill or upscale the competency of this team. Because your failures can come not just from your hands, but from the hands of any one of your team members. So you should also know that knowledge is different from capability, and surgical training comes from mentorship and hard work and not from Google. And I would also like to say that competency does not come from lunchtime or cadaver workshops. They can initiate your interest, they can show you what it is, but a fellowship with a good mentor is very important. This is extremely important. You need to take the time to go to a good mentor and learn everything. I was very interestingly watching the session that was taken place. So what is most important in disc? Is it the outcome or the size of the incision or the size of the tube, or is it 2 millimeters or 4 millimeters, or whether the surgery is 10 minutes or 20 minutes or 40 minutes? And I was completely amazed that the 30 minutes discussion was about all the things which in my mind, when I have got full of grey hairs and bald head, is totally inconsequential to the patient. All that we are talking about 4 minutes or 10 minutes or 4 millimeters or 12 minutes is your own ego. And when our Paramacharya was talking about it, I felt you are evaluating yourself and against some person. If your incision is 8 millimeters and his incision is 4 millimeters, you think it's different. To the patient, do you think it matters most? I can assure you, I operate quite a lot, and never ever once a patient has come and asked me, is my incision is going to be 4 millimeters or 6 millimeters or 10 millimeters. They only ask me, will my pain go? When can I go back to work? What is the recurrence rate or something? So if you're not focused properly, and if your learning is going to be only by workshops and meetings, you will be completely diverted into technology and not actually the biology of your entire surgery. So this is very important, and you must make sure, I'm not against anything, but if you are interested in something, you must go to the best person in that field and spend some time with him, see how they apply the technology, and that will help you to prevent failures. Professional competence is very important because we all have to remember that at the receiving end of the scalpel is a patient who's a husband, mother, wife, son or father to somebody. And whenever we see large amount of problems like this, we know that there is certain amount of professional competency for it. Yeah, this is good. You know, even mics work better when they have a condom around it. That's what one of my professors used to say. Yeah, okay. So what is most important is sweat a lot in preparation so that you will bleed less in war. And that's the British military motto. And Bob Ackland, plastic surgeon, he said, preparation is key success. Before you start any surgery, you must have done the procedure a few times in your mind, practice it, everything. And if you're starting a new procedure, it may be endoscopy or transforaminal, make sure that you're not sandwiching it between two important surgeries. I always used to do every one of my single procedure, which I start first on a Sunday morning, relax, no other surgeries, everybody quiet, happening like that. That's very, very important. And be sure that effort is very important. Now this is something from...
I hope they will be useful in the world beyond...
Are you able to hear? No?
Effortless.
No, this is very important. Audio is not working. Sound. Now mic is not. Audio? Yeah. Okay. Yeah. Now this is very important because
let's call them tennis lessons. I hope they will be useful in the world beyond Dartmouth. So here's the first. Effortless is a myth. I mean it. I say that as someone who has heard that word a lot. Effortless. People would say my play was effortless. Most of the time they meant it as a compliment. But it used to frustrate me when they would say he barely broke a sweat. I didn't get where I got on pure talent alone. I got there by trying to outwork my opponents. I believed in myself, but belief in yourself has to be earned. Yes, talent matters. I'm not going to stand here and tell you it doesn't. But talent has a broad definition. Most of the time, it's not about having a gift. It's about having grit.
It's not about talent. It's about effort and grit. So when you look at all the stalwarts sitting in the front and having been successful, you have to look at how much effort they have put over here. Second important thing is don't be worried about hard work, because there is a lot of things like saying if you're working too hard, you will do. I can assure you from what I have observed a lot is that there is a confusion in every young person's mind about hard work and stress. These are completely different. Hard work I don't think has killed anybody, whereas stress has killed lots and lots of people. And hard work gives you good performance, whereas stress is produced by poor performance. You get frustrated when you do even a small surgery badly, but you get elated when you do even 10 surgeries really well. That's one of the best days you will always remember. Now let's look at this. If you have to throw a net on the sea, I mean you can do it. two different ways of doing it, and who's more stressed? I mean, it's poor performance which actually this, and you have to be very patient for success. I think this is very important, and whenever you see somebody successful, you can be 100% sure that lots of effort has gone behind that success. So Sachin was asked the question, how did you get the six so effortlessly? And he said, it took me years of effort to get that effortless six. Rahman said, for every song that I do, it takes me twice the time because I am working on it day and night. And Narayanamurthy said, it took us 25 years to be called as overnight success. Don't forget that. I mean, it's really very important. And even amidst a huge amount of competition, there will be one common factor for us. At any stage of your profession, there will be competition. There is a lot of pressure to be seen as different and better than your peers. Let me tell you, you will be successful if you are different from your peers in your patient care. Not by changing your incision or not by changing your tubes, because ultimately for the patient, he has come. So you need to be really sure that you're giving the best. And don't enter into the rat race of competition, numbers, what are you doing, how many are doing. Because if the culture encourages a rat race, you should not be surprised that all of us start behaving like a rat. This is something that you have to be really careful. Fifth important point is, don't celebrate success too early and don't fall for instant gratification. And this is a major issue when you have in these times of social media. Every day morning you can find lots of messages, my publication, and it will be in one of the smallest journals which is actually asking people to send articles for publication. I have published 2 papers, I have done this transforaminal endoscopy, I have done this, and I also got a message 3 days ago, I performed a rare surgery, TILIF. So I was just thinking, am I reading it wrong or something like that? And there were lots of thumbs up and claps and everything attached to it. So when you fall for this instant gratification and small time beliefs, then it will happen. Now we have to know that Watson and Crick, Watson, before he got the Nobel Prize, he had published only 8 papers. And the last 2 of his papers got him the Nobel Prize. I mean, he hadn't published 500 or 600 papers. So quality is more important than quantity. And if your aim is to climb Mount Everest, you should not have a big dinner party celebration at every 100 meters that you are climbing up. I mean, the celebration should be at the top. So don't celebrate your success too early, and that's very important. Distractions from profession is so much possible nowadays. You should avoid this. That helps you to sway away from your aims. So James Cameron, the filmmaker, he said he was focused on 4 years, and whenever he produces a big classic, for 4 years he is cut off from the rest of the world because he doesn't want to be distracted. And this is something that is very important. Nothing else pretty much interested me in that period of time which I finished work. And eliminate distractions. Stephen King said, when he is working on any one of the big novels, there is no TV, no video games, and he draws the curtain to the rest of the world till he finishes that book. And they are all the greatest people who give us good. And form good and safe protocols for your procedure. And this is exactly one more thing that we need to emphasize, and which Amit also said. If you have a procedure that is doing well in your hands and has been safe for your patients, think twice. I would say actually think many times before changing to a more costly, more instrumental, more challenging or an unproved procedure. And if you are considering a new procedure, please always ask, will it help my patient? Somebody in the discussion actually got up in the mic and said we should ask, will I do this for my relative? And after that I put this slide, added this slide over. In 1988 in Brussels, there was a big meeting, and at that time 360 degrees fusion for spondylolisthesis was the most. If you are not doing 360 degrees fusion, you are not a spine surgeon. You are not up to the mark. And Alf Nicholson actually, after a big, there was a big fight meeting also there also, and then he put this up and said, this is a 42-year-old patient who is having pain occasionally for the last 6 months. not able to do his golf for the last 1 month. So what will you do? There was a lot of audience response this thing went up to. But the persons who were divided on what they would do, but 98% opted for surgery. So then he asked, this is your wife's X-ray. How many of you would operate immediately? So it fell down to 38%. And then he asked, this is yours. How many of you will go back to your hospital and have a 360-degree fusion? It fell down to 2%. So this only shows the hypocrisy, but also how much orthopedic surgeons love themselves more than their wives also. So 38% would subject their wives to operation, but only 2% would subject themselves to this operation. So complications escalate to disastrous failures when you sit down and write. If there is a complication, make sure that you treat it very exactly. And you should also perform a surgery or a new procedure only when you know how to manage its intra or post-operative complications. You are changing to a new form of discectomy, but know if there is a CSF leaf, how you would treat it or how you can do it. And then you can go on to that procedure, there is no problem. Because by eliminating all avoidable possibilities, make your failures unavoidable. And when you know that this failure was unavoidable, then your conscience is at rest. You don't feel so bad at it. So lastly, however good you are, failure will sometimes strike. And here, these are some things that I have found it useful for myself and also noting how people take failures when they happen. First and foremost, don't personalize a professional failure. I mean, you can fail as a profession, but one single case failure or some procedure failure is not a failure of yourself. So that the treatment was a failure does not mean that you are a failure. So when you take it personally, and that comes when you're also taking your success personally. So when you're doing a surgery and it goes well, then you say, I am God. That is the problem when something goes wrong, then you think that you are the time of a success. I was very impressed with Amit's this thing. We treat but God heals. But this is something that what Ambrose Pere, the first surgeon of the world of modern times, he wrote on his epitaph, on his tombstone. He asked it to be written, I treated, but God healed all the times it healed. So, when you know that when sometimes it goes wrong, when occasionally it will do, you don't take it personally because you didn't take all your success personally. That's very important. And don't cling to your failures. Keep the memory of failures short. The 24-hour rule is very important. The Air Force responds to air crashes. So whenever they have an air crash, the Air Force squadron actually makes all their pilots to fly a sortie immediately so that they will get over it of thinking of the failure very often. So this is very important. Third thing is, you should not think the whole world is looking at your failure all the time. No one cares about your failures as much as you do. All of us have enough problems and failures in our life of our own. So they would just talk about it something but not take it personally. So don't cling to your failure for too long a period of time. It's just a waste of time because we are not alone when we fail. I mean, this is something Michael Jordan, who is considered to be the best ever of basketball, he said, I have missed more than 9,000 shots in my career. I have lost almost 300 games. On 26 occasions, I have been entrusted to take the game-winning shot and I missed. I have failed over and over and over again in my life. I learned from them and that is why I succeeded. You should not think I am the only guy who had this complication. I mean, everybody has. But when you have a complication or when you have a challenge in life, it is so important with whom you are having company with. People who will comfort you, people who will pull you up. It's so important than people who will pull you down. It is so important with whom you are at your times of success and times of failure. Make sure that you do not forget your true friends and family in the times of success, because that is the time that you will need them when you are having some failure. So this is very, very important. So you must have seen here, work, spirit, friends, family and health. Work can wait, but all the other 4 balls are glass balls. You should not let it drop from your life. You are the sum average of the 5 people with whom you spend your time with. So when you're young and when you're coming up, when you're going up, make sure that you are with the right 5 people around you, so that will put you into the proper perspective. It will also teach you what is the important things in life, what are not important in life, so that you don't get distracted, and this is very important. Convert your frustration. When something happens down, I think this I have found it very useful, one of the articles I read. You can convert every one of your frustration and failure into a high positive action for a higher goal. And every successful person has done this. Usain Bolt, who is called to be one of the biggest guys, he was disqualified for a year from any match because of a false start. And if you don't run for 1 or 2 years, you're out of the league. But he actually went back and said, okay, I'm going to use these 2 years to come back as the fastest person the world has ever known. And after that, you can see before every match, he always did this. That means that I am aiming for the sky every time that I am running. And that's what made him the fastest manager. And lastly, when things don't work out well, take a break, find some humor, and that's the purpose of life. Now, this is my last slide, but you have to watch this carefully. So, Gordon Evans was playing and he was playing really bad. And this is a ATP main tournament. He was just losing points continuously for 12 points. He's saying you can't play better, worse than me, so go. You see, there are lots of things involved. It was not just Gordon, it was also his opponent and the referee and everybody around who can convert a disaster situation into something which Gordon went on to, he didn't win the match in the end, but it was always remembered as one of the biggest sportsmanship. So this situation will happen to all of us, and you need to take a break. Look at the best part of it and see how you can. So all that I have spoken of taking your profession seriously, putting in hard work, being adaptable from time to time. And Arvind was a person who was known as the best deformity surgeon. And we were always looking, when he was putting all these huge incisions and anterior releases and anterior reconstructions for deformity. But he was also one of the founders of MISSAB. That's the true greatness of all these people. For everything good and to be good in life and to be above all, not to take yourself seriously but take your profession seriously and to be a very nice person. We cannot remember anybody better than Arvind. And as long as MISSABCON is there, Arvind will never be forgotten. And that is one of the best important things that has happened to MISSABCON and also to him. So those who live in the hearts of others can never die. And Arvind will always be with us. Thank you very much for this opportunity. Thank you.